Hi everyone, my name is Jorge and I'm the program manager here at Doctors for Change. Today we're going to be discussing a MET training opportunity that we partner with organizations here in Houston. We're excited to have this conversation with Dr. Kowalchuk. Dr. Kowalchuk, please introduce yourself and let us know about this opportunity.
Yeah, so I'm Alicia, Dr. Kowalchuk. I'm with Baylor College of Medicine. I'm an associate professor there. I'm also board certified in both family medicine and addiction medicine. And I'm working on a project with both the Harris County Health Department and the Houston Health Department that is about, in part, training more providers, healthcare providers, to provide medication treatment for opiate use disorders, particularly in the primary care setting. And so through this project, I'll be offering quarterly trainings, and our first one's coming up in June, on June 20th, for providers to learn how to be able to incorporate treating opiate use disorders in their practices, and specifically to be able to get a DEA waiver to be able to prescribe buprenorphine products for the treatment of opiate use disorder. So that's what the training is going to be about on June 20th. It is a 4-hour training. We're going to be doing that in the morning, and it is going to be virtual just like this afternoon. The 4-hour training is the first half of the training to be able to qualify for a DEA waiver to be licensed to prescribe buprenorphine. And the second part is a free online training that you do, at your own pace. And then you are able to apply for a waiver and start treating patients for this condition. And we know that it's really impacting Houston even through all the COVID pandemic. We're still seeing pretty concerning rates of opiate use disorder and bad consequences from opiate use disorders such as overdoses. And I wanted to share a little bit about that most recent data as well, and also leave it open for questions. So if folks do have questions, please let us know, and I'm happy to answer either at the end or throughout the presentation.
Perfect. Thank you very much for the overview. So for attendees, we may or may not be able to unmute you for this. So please be prepared to type your questions inside the chat box. And if you have any questions, please feel free to reach out to me. You could also message me directly on the voice chat and we'll set you up. But we're excited to have this partnership with you. We're excited to learn a little bit more about this opportunity. And so I appreciate that. Thank you.
And Jorge, is everyone able to see my screen now?
Yes, correct.
Okay, great. So I did it correctly. This is my first time using GoToWebinar, so thanks everyone for your patience with this. I want to thank my colleagues at the Houston Recovery Center who put together this most recent data on opioids in Houston. And this is data applicable through our pandemic that we're going through right now. Some of this data has been collated from UT Health, the Texas Health Science Center. And what we see is that Houston sees 1 opioid-related deaths every 32 hours. And we see that the death rate continues to rise across Texas related to opioids, as well as the country. And looking at Houston Police and Fire Department data, 50 to 100 reports of opioid overdoses come in monthly through that data. And of those, every about anywhere from 25 to 33% of those overdose reports are fatalities. So again, something that really impacts our community. One of the other programs I work with is called the Frontlines program, and that's about early intervention when folks do get transported to an emergency center for treatment of their overdose. And our program responds and provides some education around overdose prevention and tries to, through peer support, link folks to treatment. And one of the big barriers we've seen with our program is just a real lack of treatment access within our community and the lack of a number of treatment slots for patients to really engage in effective care. So again, let's see what we know about the opioid epidemic and how it's impacted Houston. We have seen an increase in overdoses from both our Frontlines program, and there's another program run out of UT Houston Health Science Center called the HEROES program that also involves interventions in the emergency department at Memorial Hermann Medical Center, and also outreach to patients or people's homes who have suffered an overdose and survived and gone home. As well as this data is coming from Houston Fire Department, and we're seeing that they are increasing through this pandemic. We're also seeing that it's not just opioids, we're seeing that polysubstance is pretty much the norm. You know, this it could be from a variety of reasons, but one thing we are learning is that access to illegal drugs has been really impacted, like every access to other things in this pandemic. And so folks are turning to a variety of substances to achieve a similar high. We're also seeing an increase in the amounts of naloxone. One of the brands of naloxone is Narcan. That's one of the products. How much Narcan or naloxone it takes to reverse an overdose is increasing, which speaks to potency of the illegal opioids that people are consuming during the epidemic. And so what we're fearing is a resurgence of fentanyl in our community. Let's see, we all are also seeing simultaneously an increase in prices of street drugs, including opioids. And again, a switch to synthetic opioids because for a given amount of a substance, you're going to get a bigger bang for your buck, so to speak, from a synthetic. We're also really fearful in the recovery community about increase in relapse rates. So we do know that stressful events in general can lead to increased rates of relapse, and certainly the COVID-19 pandemic and the self-isolation and the disruption to regular routines, as well as economic disruption, has really impacted everyone in our community. But for folks with a substance use disorder, that can be a relapse trigger. We also have seen that many treatment programs and long-term support programs, mutual aid societies like 12-step meetings, et cetera, have transitioned for safety during the pandemic to be virtual only. And that's certainly better than them not existing or continuing to meet, but is not the same as in person in terms of providing support. So we do know that recovery is possible, particularly for opiate use disorder. The gold standard for treatment of opiate use disorder is actually medication treatment, sometimes referred to as medication assisted therapy. And buprenorphine is one of those therapies that can be prescribed in general medical settings. You don't have to be an addiction medicine specialist or have that type of practice to be able to do that work. And so really, we've been working in a number of programs that address the opiate use disorder within our communities to increase people's linkages to care, to get naloxone out there for prevention of overdose in the front line, and again, to get people into care that's available. But our big barrier is that there just aren't enough providers doing this work and accepting patients to provide the care that we need to keep people from kind of going back from an overdose, coming back from an overdose, and then going right back out there, not getting the treatment that they need, and having another overdose. And that's the slides that I have to share today. Sorry, I have an automatic timer on my office thing, and we can stop share screen now. It'll be fine. I'm not sure how to do that on this. So Jorge, can you help me with that?
Absolutely. So I'll get started with the ending the screen real quick. 1 second.
And so I know that's a lot of me talking. So if folks have questions about what the training looks like, what incorporating this into practice looks like, other questions about the opiate epidemic, I'm happy to take questions.
Absolutely, and thank you so much for that presentation. That was a really good presentation, really giving us a good understanding of the overall combat with opioid abuse here in Houston, and why it's so important for us to really unite and work together to help combat this. So we're super excited about the opportunity to have this collaboration and provide this mat training opportunity. And if there are any questions for our audience members, I'm gonna try to unmute you, and if you have any questions, and if I can unmute you, please drop a question in the poll box, in the chat box. Okay, good. So far, we don't have any questions so far, but just to give a quick recap over the mat training and what the outlook is for that, I guess I would like to just kind of give another recap for people who may have joined late maybe throughout the presentation. But could you give us a kind of quick recap and overall perspective of what the mat training looks like and what this opportunity means?
Yeah, so the training's coming up on Saturday, June 20th. It's going to be in the morning. It's a 4-hour training. And at that training, you'll learn how to treat folks with opiate use disorder with medication therapies. You'll also learn about non-medication therapies as well, and links into the community for that. The training does satisfy half of the required training for getting a waiver from the DEA, the Drug Enforcement Agency, to be able to legally prescribe buprenorphine for opiate use disorder in your practice. You will subsequently, if you're interested in doing that work, you would complete a free online 4-hour training as well, and that online training is something you can do asynchronously, when you have time to do that, and then that completes the total requirement of 8 hours training. If you are a physician, if you are an advanced practitioner, then you would have an 18-hour online component, which this 4-hour in-person component also sets you up to be able to complete. And that is also free. And then you're able to, once you complete that, apply for the waiver. It's a really quick process that we go over during the 4-hour training. And we will also be providing support after the training for folks, to complete the online portion. If they've completed in the online portion, to take the next step and apply for the waiver. And after applying for the waiver, we're here to support you in getting started in your practice, with things like EHR templates, if that would help you get started, troubleshooting, kind of some of the logistical challenge that can arise when you first start out with this, and even available for real-time consultation. So you have someone in your office and you're not sure, is this a good first patient to start with this? And I've been doing buprenorphine treatment for my patients since 2008. So 12 years now. I've been certified since 2004. So it took me a while to get started, so I know about that. So the real goal of this is to get people the information that they want about opiate use disorder and how it can be treated, and then hopefully to help people engage and want to do that work within their own practice, and help them troubleshoot and get around any logistical or other barriers to actually make it happen for themselves and their patients. I should say again, stress, the training is free, free. If there's some ad about that now, right, on the TV. So that we're all probably watching way too much of during our self-isolation. And it will be in this format, so it will be an online experience.
Absolutely. So our role here at Doctors for Change is to help really promote this training, to help ensure that we're reaching our targeted audience. And I know you mentioned this in your discussion over the overall training, but I really want to get a definition of who is the overall target audience for this training, so that I can make sure that we reach out to them to make sure that we really present this opportunity to them.
So the target are really particularly primary care, but any healthcare providers that have a DEA license that would want to incorporate this into what they do clinically with their patients. So primary care folks are often interested in doing this work. Also, sometimes people that are in pain management and specialty care along those lines are interested in getting involved in this work. And then, I'm happy to train folks and have folks learn more about opiate use disorder that might just be thinking about it. I know I've seen a few patients in my practice and I've struggled with how to help them, what resources are available. I'm not sure I personally want to do this, but I want more information. I'm intrigued. Come and we'll talk about it. And at least you'll leave with more information, if not feeling like this is something that you really want to do. I can say from, over a decade of experience in this work, it's very rewarding work. You see pretty quickly people turn around their lives in very dramatic fashion. This is the #1 accidental cause of death in our country for people under the age of 54, I believe now we're up to 54 on that. And so it's a big impact for our country. And there aren't enough of us that are doing this work to adequately take care of everyone who really needs the care. So that is the whole goal of this, is to get more of us doing the work.
Absolutely, yeah. And for me personally, I'm not a medical provider. However, I am super interested in learning more about this training and overall what it means and really what the impact is. So the presentation you provided really provided kind of a really good quick overview of the impact that this opioid crisis is having in Houston, and what we could do as a community, as a medical community, and Doctors for Change, to help stop that, to really prevent that from really growing more than it is now. So I do want to ensure that I check in with our audience members. Again, we are open for questions. So you're welcome to provide that in the chat box. And again, if you would like to, for me to unmute you, I think I do have the capability. Yeah, I do. I learned something new. So we'll wait a little bit for us to see if we get any questions. And if not, we'll close out the presentation, and we'll be sure to have this ready to promote it on our DFC website and YouTube page.
Sure. I should mention too that in the past, we weren't able to do visits for medication-assisted therapy, particularly for buprenorphine. One of the most common brand names for that is Suboxone, so people may know it by that name more than buprenorphine. We weren't able to do virtual visits for that legally, but that has, with the COVID-19 pandemic, just like a lot of things have been relaxed around telehealth visits, we are able now to see our patients, both new and return patients, through telehealth and do this work. So I know, at least in my practice, I've gone from zero telehealth to the majority of visits being telehealth now in a very short amount of time. And talking to my colleagues around the med center and the community health centers, I'm, hearing the same type of experiences. So if there's a concern about, well, I don't know if this fits, with this new telehealth model, it's actually a type of visit that's very easy to work into telehealth and is legally supported to do telehealth in that way.
All right, thanks so much. So I got a quick call about a bit of a troubleshooting issue. So we do have questions, but the chat box isn't working for our audience. But I'm seeing now that I did get some text messages on some questions, so I'm going to give you some questions. And I'm going to look on here because I do see some here. All right. So I'm going to start off with a question from Ariana. She's our executive director at Doctors for Change. She said, we have some interested participants that are coming to Houston and in the process of getting licensed. Can they join the training? Even if they have not been approved to practice?
Yes, so the training doesn't expire. So if they take the 4-hour in-person training, once that's completed, they'll get a link, an email link within 48 hours to access the online training. They have to complete the in-person first. Once they complete that, this is a national training, nationally accredited training program. And so that is transferable. So it's not specific to the state of Texas. We are looking to train providers that are going to be working in our greater Houston area, but certainly, if it's going to be 6 months or a year before they actually get their Texas license, they can still apply if they have their current DEA to get the waiver, and then they'd be ready to go as soon as they get the Texas license. So that's a great question.
Okay, thank you. So our second question, this is from our board chair, Dr. Reed. He says, have you seen this been incorporated into medical school curriculum? Yeah,
so actually I work on another grant funded project and we are actively incorporating it into medical curriculum here at Baylor College of Medicine. I have a colleague at UT Health Science Center that is incorporating into our local UT curriculum as well. It's kind of a national push to get this incorporated so that physicians aren't going to get out of training and have to do this separate 8 hours. It's just going to be all done as part of their MD degree. But we're not quite there yet. So our graduates leaving next year will all have been trained, or waiver trained is what we call it. But then we also have a lot of folks already out in practice that certainly we'd like to get on board. Great question, Dr. Reed. Thank you.
And part two of this question is, can you review the curricula, the current limits on the numbers of patients that can be managed with MAT?
Sure. And I think sometimes the limits are really helpful because you don't have to get overwhelmed with this work. I think some people are reluctant to get into the work because they think if I get one patient, I'm going to be all of a sudden flooded with a bunch of patients, and I don't want my practice to skew just to treating opiate use disorder. And so I know that can be a big fear for folks getting into this work. And there are limits on the number of patients that you can accept at any given time. So the first year that you're waivered, you can only have 30 patients actively in your care getting buprenorphine with you through your waiver for the first year. After a year, you can apply. Again, it's a very similar process, except you don't do additional training. You just verify that attest to having been using your waiver for a year. And then you can increase your cap to 100 patients. After a year of that, and you're maxed out at 100 patients, then you can apply to increase that cap to 275 patients, but you can never go above 275. And so a lot of folks, get their waiver, and they're really doing it to help those handful of patients within their own practice that they see come through and struggle with this, and be able to offer that to them. And, that's okay. That's great. We need all the help we can get. And a lot of people trained and seeing, 10, 20, 30 patients really helps in the community, the more folks that we can get out there and get doing this.
Okay, thank you. So another question we have, and I'll mention this. The questions box is working. So I was looking at the wrong spot. So I apologize to y'all. I apologize to you as well. And the questions box is working. So if you do have any additional questions, feel free to drop them on there and I'll be sure to capture them. So the question we have is, this is from Reddy. He is an advocate at Doctors for Change. He said, are the differences of pediatric or gynecological, no, are there differences for pediatric or gynecological providers?
Yeah, so for pediatricians, buprenorphine is FDA approved for treating opiate use disorder in patients 16 and older. We do cover that in the training. And then for obstetrical patients, methadone has historically been the gold standard for opiate use disorder treatment in pregnancy, but there are a number of studies, again, which we review in the training, that support buprenorphine being used as well for treatment of opiate use disorder in pregnancy, and certainly I've done that and had good outcomes. In fact, we see pretty equivalent outcomes for moms with opiate use disorder who are maintained on methadone versus treated with buprenorphine through their pregnancy. Where we see a huge difference and a huge positive difference for buprenorphine as compared with methadone is the babies that are born to moms who are maintained on buprenorphine are usually have better experiences in terms of neonatal abstinence syndrome, so decreased rates, decreased severity, which you would expect because buprenorphine is a partial opiate agonist versus methadone, which is a full opiate agonist. So there's now robust data to support using buprenorphine during pregnancy. Great question.
All right, perfect. So now we're at the 4-minute mark now. And I want to open this up for any closing remarks from you, Dr. Kowalchuk, and also for any last questions we have as well.
So yeah, I'll pause for last questions as I feel like I've talked a lot. And just want to say, again, everyone's welcome to the training, even doctors in training. So residents, medical students who haven't gotten it yet at their institution are welcome to come. And again, our primary focus is on getting more doctors who are actively practicing medicine in Houston on board and comfortable providing this life-saving treatment to their patients.
Okay, perfect. So thank you so much for your time, first of all, for giving us the opportunity to learn more about this. This was very helpful. And I'm excited to really promote this more and to ensure that we do reach our target audience for this opportunity. And I think our questions are a bit wrapped up. I think we have no more questions in the chat box. Again, thank you so much again for meeting with us and for joining us in this overall mission to combat opioid use here in Houston. Thank you again, and I think we're pretty much wrapped up for our meeting today.
Great, and thanks everyone who came. I really appreciate it.
Absolutely. Thank you so much to the audience members as well for being a part of this. And if you have any questions, feel free to reach out to me directly, and I'll be sure to make sure you get any information about this meeting we had as well. So thank you all. Thank you, Dr. Kowalchuk, for this time. I appreciate you all. Thank you.
Thanks, Jorge. Bye.